Early symptoms of pollution-related illnesses in kids are mostly related to respiratory symptoms. For example, coughing and wheezing, throat irritation, breathing difficulties, increased respiratory infections. But apart from respiratory system, other systems can also be involved. For example, eyes, we get eye discharge, eye irritation. There could be skin allergies. Constant headache and fatigue could be a manifestation, and then sleep disturbances. So these are all common and early signs of pollution-related illnesses in kids. So pollution-related illnesses mostly are not contagious, and usually we see during a particular period of year when these illnesses are more common, whenever the AQI is more and we can feel the pollution, then you will expect more respiratory related illnesses. While with other viral related symptoms, it may be present throughout the year and it is contagious. That means if one family member is affected, then there is a likelihood that other family members may also be affected. And also there will be some other symptom in viral illnesses, for example, presence of fever, which is usually not present in pollution related illness, although sometimes it may be very difficult to differentiate early on between pollution related illnesses symptoms and other common cough and cold. But by and large, presence of fever, presence of similar illness in other family members, this all kind of point towards more in viral etiology. The basic idea is to remain indoors as much as possible, keeping the windows closed, using air purifiers to maintain good indoor air quality, and cleaning regularly. These are the important facts. So we normally say that early on, that means early during the day, that means early morning and late evenings are the worst times of the day when the AQI is high and the pollutants are at the level of our nose. So you breathe in more pollutants. So during daytime, especially between 10 a.m. till 4 p.m., this is the time when, because of sun and because of the changes in the particulate matter and the humidity levels, the pollutants are slightly above the human body level. So the chances of inhalation of smoke, dust, pollutants is less as compared to early in the morning and late during the evening. So making sure that we remain indoors most of the time and making sure that our windows, doors remain closed, making sure that the AQI of the house is acceptable is important. There is no definite role of vitamin supplementation. However, we say that good vitamin D, good vitamin C levels do help. So we have to make sure that the vitamin D levels are fine. If needed, we can get supplements based on the blood levels. Vitamin C is considered to be a good immunity booster. So usually we recommend getting it from the food itself. But however, there is an increased likelihood of respiratory illness. Sometimes we do prescribe vitamin C, but these are not routine recommendations. So this should be discussed with the doctor and should be taken as and when needed. It's not a routine prescription. To minimize pollution effects and to maximize health benefits during these tough times, we have to make sure that we are getting ourselves exposed as less as possible, and therefore we have to check the AQI and accordingly plan our day. Wearing a high quality mask like an N95 also is very protective, and we have to limit exposure during peak hours. We have to make sure that whenever we are traveling, we are choosing less polluted routes. It's common to get exacerbations of asthma, bronchitis in kids who have these diseases during these difficult times when the AQI is high. So we normally suggest that we should continue using the medications which the child is on. It's very important to continue it throughout the period. And as we discussed that we have to make sure that we are exposed to the pollutants as less as possible. So keeping the child indoors, using air purifiers, good hydration, and of course there is a role of vaccine as well, though as the child is eligible for the vaccination must be done, especially flu shots, and also that there is no super added viral infection that can actually worsen the existing illness. So with these precautions, we have to make sure that child who is already little sensitive in terms of the respiratory system, like those having asthma and bronchitis, should be exposed less and continue medicines with vaccination as and when applicable. So long-term exposure to recurrent pollution can lead to a variety of health problems, which includes chronic respiratory illnesses like asthma, COPD, sometimes heart disease, stroke, various cancers, and damage to vital organs. So, we are in a difficult situation wherein every year we are exposed to pollutants, and the idea is to minimize the exposure as much as possible.